Hi everyone, welcome to the first White Coat Wednesday here in Brisbane, Australia. My name is Tiffany, I'm a second year medical student. I am also the Year 1 and Year 2 Ochsner Medical Student Association Executive Officer, and I received my undergraduate degree from the University of California, Davis. Today I have Cam here with me. Cam, do you want to do a short intro?
Sure, yeah. My name's Cameron. I graduated from the Mercer University. I am a second year student at Ochsner UQ. And I am also the Year 1 and Year 2 academic officer for the Ochsner Medical Student Association.
So what we're going to talk about today is just our experiences with Year 1 and Year 2 thus far. So Cam, do you have any highlights from Year 1 that you want to share?
Sure. So last year in mid-January, we moved to Brisbane. With that transition, it was meeting a ton of new people, finding a place to live and finding a roommate and such. I got really lucky. I found someone else who's also from Georgia in the program and has become my best friend. Through that, I've also met tons of other Ochners who live near me, who we all commute to campus and to hospitals together. Throughout first year, the curriculum has let me meet so many different students who are both from Australia and from overseas, whether it's from the States or Canada or somewhere else where it may be. I've really enjoyed the kind of experiences that we get to have where we're learning with 10 people or the whole cohort of 500. What's some things that you found interesting from your first year?
First year was very interesting in the way that, we moved to a different country, moved here with knowing nobody at all. I had the opportunity of meeting a couple of people who lived in my area before coming here, and that was so great because, it was nice to just have some familiar faces moving halfway across the world. Finding housing, also coming to such a large cohort, it's very daunting, especially if you haven't met a lot of people coming in. So it was nice that the older Ochsner students, the second years, they had a little barbecue for us, the market day. So it's nice to just meet more people and sort of get comfortable in a new country. What about you? How are your experiences?
I have really enjoyed my time in Brisbane. Like you've said already, meeting the other Ochsner students has been a pleasure. Everyone just has this kind of shared interest in medicine, but also we all picked up and moved halfway across the world to do medicine, which is such a unique experience. I'd like to say even meeting the domestic students too has been so much fun. They bring such a different perspective to what we do learn in medicine. And then also the other international students, even though we all have different goals and countries that we do want to eventually practice medicine in, we all are very driven and hardworking, and it's just so much fun to be around.
Yeah, I totally agree. I was able to get really close to some Canadians and some Australians last year through my little timetable group. So it was nice to just, see their experiences, their point of views in so many different areas of medicine that, you wouldn't even think of. And it was also really great to just have a solid group of 10 people within your timetable just to get more comfortable with as you move through your first year because, like I said previously, it's such a large class. Did you enjoy your 10-person timetable group?
I did. My group had a great mix of Ochsner students as well as domestic students. And within the domestic students that I was with, there were some that were also on the rural pathways. And so talking to these people that are coming from rural Queensland, as well as big cities like Sydney and even Los Angeles, and just hearing the different perspectives of where everyone came from. It was also very interesting because talking to Australians, there's people coming from nursing and people coming from dentistry coming into medical school, providing a very unique perspective for our discussions during classes.
Yeah, I totally agree. So during my H&E classes, which are my history and examination classes, we kind of discuss different presentations that patients can come in with one very particular disease, and it's so nice to pick everyone's brain just because, you think so much about one thing, and then other people come in and they're just like, actually, no, you can also see this and this or that, etc.
I really enjoyed my H&E. H&E, or History and Examination class, is with a practicing physician who is teaching us about how to take a history for each system and also how to complete the examinations. And it was always really interesting to hear my tutor go a little bit off script to talk about personal anecdotes and how it's actually applicable to the clinical setting in first year. And taking that knowledge from first year and now as a second year student, being able to use a little bit of it in the clinic has been really interesting.
Yeah, so you mentioned clinic. I know that we have a full day of clinical care in second year. I know currently I'm in the GP placement, which is like at a general practice. And I know you're doing clinical care and outpatient. Do you want to talk a little bit about that?
Sure, yeah. So I am placed at a collaborative care and an outpatient clinic every week. I spend 2 different afternoons, one afternoon following a physician in a given specialty. So for example, I've spent afternoons in renal clinic, I've spent afternoons in cardiology clinic and gastroenterology clinics. But then the other day of the week, I spend shadowing other professionals that are part of the healthcare environment. I've spent a few weeks following radiographers, I've followed social workers, I've followed nurses, seeing how different specialties function and how the clinics run is very interesting. Seeing how one clinic might go a lot slower, where you spend an hour interviewing a patient, whereas another is just checking in with a patient every 3 months to make sure things are on track for like a chronic condition. It's just been really interesting. But above all, I think the most useful thing I've seen has been how all the behind the scenes kind of works in a hospital. So many of these things that we as physicians will order would not happen without our radiographers, our nurses, our patient transport and stuff like that. So it's just been really valuable to see how a physician is only just part of this huge collaborative team.
Yeah. I can't wait to move into that side of my placement next semester.
Sure. Do you mind talking a little bit about what being in a GP clinic is like?
Yeah. So being in a GP clinic, I'm there for about 8 hours a day, or 8 hours a day once a week. And, I stick with that one doctor who I'm assigned to, and she just brings me in on every single patient that she sees that day. So it's very interesting to see how we can go from seeing literally a 1-week-old baby up all the way to like a 90-something-year-old grandma. It's how she's been their GP for over like 20 years, and she knows about their lives so deeply, and she literally just knows everything about their family, their like medical history and all that stuff. So being able to see how like the empathy that she kind of gives to these patients when they're going through something difficult, or even to a new patient, has been so rewarding, because it's not something you really think about until you're in that setting, I would say. And my GP, she also does a lot of skin checks. And the first day on placement, she literally threw me in, was like, have you done a shave biopsy before? And I was like, no, I haven't. And she was like, well, here's your first one today. You got to start somewhere. So that was a little nerve-wracking for me. But, I think it was also one of those things where I kind of showed my GP that I was willing to do something and not really be scared of it. And so she kind of gave me a little bit more freedom to kind of talk to patients, take a history from them, as well as do a bunch of different vaccinations and other biopsies and such. So it's been a really great experience.
That sounds like so much fun.
I know.
Yeah.
How have your second year otherwise been?
It's been great. So our second year, we spend a ton of time with our 10-person group. I think majority of my time on campus is with the same 10 people. So we've gotten very close over the past 8 weeks. We have these case-based scenarios that we use to learn throughout our second year. So these are scenarios put out by the professors who follow a kind of a common presentation of a disease or pathogenesis, just to get us through all of the main points of diagnosis, imaging, examination, all the way through in just a 2-hour block. It's been very rewarding to go through those and be able to pick apart all the differential diagnoses that could happen. What has your experience been with that so far?
Yeah, I would say I agree. I really like the whole clinical scenario presented as, kind of not so much a lecture, but for you to learn from. You kind of pick up on things that are obviously not more important, but come up more often for each clinical case. And you can kind of start making your mind map of all the different possibilities of diagnoses that could be within 2 minutes of reading the case, because that's, what it's going to be like in the future. You see a patient with fever and you're like, oh, what could it be? So it's nice to get a head start on that and start thinking of it that way. But it's been a great year so far.
Yeah. Well, thank you for joining us for our first White Coat Wednesday in Brisbane. Please join us for the next time.